When Miss Doris first got in the pool, we initiated things for dynamic hip stabilization, proprioception, and just simple strengthening activities in both lower extremities, utilizing the presence of buoyancy to just give us that extra little push. So much like Doris is demonstrating now, we just did some standing hip flexion and focusing on trying to maintain neutral dorsiflexion in that right ankle, which has not yet been fused, or hopefully will never have to be fused. Go ahead and now come out to the side. And
you want the side?
our progression then went from hip flexion to maintaining hip into a lockout position at the knee, into both abduction, adduction, flexion, and extension. Okay, now go ahead and show spooling. We use multiple planes for strengthening, both right leg and left leg, using circumvention conventionally in clockwise and counterclockwise. And slowly progressed into more of a closed chain activity, such as squats, and then into a step-up program. Go ahead and turn around and do step-ups. Once her hip strength began to improve, we were then able to go into sidestepping. Go ahead and step up the sideways, Doris, facing the pool wall. And then to improve proprioception, we worked on single limb stance with minimal upper extremity support, and challenged her with progression of both time as well as minimizing the amount and type of upper extremity support. All of these activities were initially initiated without any type of ankle support, or ankle resistance, ankle weights, and progressively as her strength improved and her safety improved and her stability through her core improved, we were able to add ankle weights and the aqua jogger system. Incorporated into all of this. And initially, since this patient was limited in just her ability of normal gait and utilized an AFO while on land, we were immediately able to eliminate the need for assistive devices and get her walking at a functional pace. Now, because she has had a status post left ankle fusion, changes the dynamic both through the knee and posterior thrust, as well as hip stabilization. So we were able to use the underwater cameras to cue her on knee extension control, as well as improved hip flexion for foot clearance. On the right side, since she had limited to none active ankle dorsiflexion, we worked on, again, proper hip control, hip flexion for safe leg advancement without an AFO. As her gait tolerance improved, we were able to then utilize the jets to offer graded resistance to help with hip and core stabilized or dynamic stabilization. After normal ambulation was improved, we were then able to go to side ambulation and a karaoke crossover, as well as retroambulation and sidestepping. I'm going to go ahead and slow all this down. Doris, go ahead and face to the side. So you're facing, there you go, 2 hands on the bar, and we're just going to sidestep. Just normal sidestep walking. Again, to focus on strengthening of the gluteus medius and safe limb advancement. Good. All right, then where we went from there is we began adding more of the resisted ankle cuffs and so on and so forth. As we began to continue our progression, we then added resistance, utilizing both weights, flotation devices, and fins.